So today we're going to talk about how to give fluids under the skin to any cat or dog patient. Today we have my actual cat Riley here with us today. He doesn't need fluids under the skin, but we're going to use him as a demonstration today. Fluids under the skin is something we give quite routinely to patients that are chronically dehydrated. Sometimes if they're in kidney disease, those are probably the biggest reasons that we'll do this. Now, what you end up doing, we have a whole setup here with kind of a new bag of fluids for them. We've got the IV line set up, and then the needle goes on the end of the IV line. So for every time we do this, we do put a fresh needle on, and so it just fits on the edge, on the end like that. And so what we end up doing is we're going to be injecting kind of typically under the skin, kind of between the shoulder blades. Cats and dogs both have a lot of extra skin kind of all over the place. You end up going in that space between the underlying muscle and the skin layer. And so a lot of times up here is kind of the easiest spot to go. Now typically what we end up doing when we go to inject, you kind of lift up the skin like so, create a little tent, and you can feel a little bit of an indent here kind of with your finger right where you're going to end up inserting the needle. You end up going parallel with the spine, not down or at a different angle. You just go straight in. And so we'll insert that, and then you kind of just let the skin drop a little bit like that. To turn the fluids on, there's a little dial here that you end up pushing upwards, and that opens it. Sometimes there's a little kink in the line, and you can see kind of right here it's got a nice little drip going on, so that means it's working. It's going in underneath of the skin area. To stop what you're doing, you end up pushing the little roller down, and that turns it off, so you can see it's not going in there. It's okay, right? And then you end up just pulling the needle out. I end up pinching kind of right where that hole is because sometimes it'll leak back out, so that kind of helps reduce that possibility there. And you just let them go. Put the cap back on the needle there. After that, you kind of follow the instructions from your veterinarian, so that way you kind of know how often to do that, but that's all there is to it.